arms towards the sun. You feel the warmth of the rays, and then you know you're alive, and you don't have to be afraid of anything, 'cause you know the truth, and the truth is love, yes it is. Wasn't what they said to you, or anything that you learned from a book or from the news. It's not like that, 'cause it's a thing. It is something that you do. Doop 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 a doo. Doop 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 a doo. Doop 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 a doo. Dib on baby did long. Doop 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 a doo.
Good afternoon and welcome to the Bassline, everyone. Dr. Kat Lindley is a family physician. Born in Croatia, she has firsthand experience with totalitarian regimes. When the gaslighting and coercion of COVID was occurring, it was reminiscent of those experiences. She observed how the psychological campaign against us went through different phases, from bargaining to outright threats. She has been one of the courageous voices demanding that we stop the shots. She has been keeping a close eye on the World Health Organization, the UN, and various indications that the power elites are leading us into a new system of global governance. I am ecstatic this afternoon to introduce the remarkable Dr. Kat Lindley to the Bassline. Welcome, Dr. Lindley. How are you today?
I'm doing great. Thank you for having me.
Oh, it's a pleasure. I want to get right into our discussion here. I want to just say, first of all, one thing that makes me so excited to have Dr. Lindley as a guest is, from all that I've heard in previous interviews and on Twitter Spaces, Dr. Lindley is a very measured personality, I would say. I find her to be very calm, very rational, very intelligible, and very reasonable. And, I love the fantastic personalities of our medical freedom movement. I love eccentric people, but we also need some grounding elements as well. We need some solid people that are a little bit more difficult to slander, maybe. I don't know. I mean, I guess we could all be slandered when the experts get to the business of slandering. But Dr. Lindley is just a very reasonable voice, and I think we really need that. And I want to also remind you, of course, this is a listener-sponsored program. Please sponsor this show in whatever form is reasonable or realistic for you. You can go to jeremiahhosea.com, buy a song for $1. I'd appreciate it. You can go to Substack and check out my Substack. I've written some pretty cool articles, and because I'm getting some sponsorship through that, I am a professional journalist now. I'm going to continue to write because you guys have supported what I'm doing, and now I'm obligated to the people who are supporting me. So thank you for that, and please help me keep the ball rolling. But as far as our discussion goes, Dr. Lindley, I want to jump right into the question of the nature of these, I think, very dangerous injections that people have been coerced into taking, convinced to take. People took these shots under various circumstances. Some people were eager to get their vaccine. Some people had no medical interest in the vaccine, but were coerced into doing so by their various states in which they live. Various countries, of course, had different policies. But one thing that we've seen is that cardiologists have spoken out saying this stuff is injuring people's hearts, it's injuring people's cardiovascular systems. We've seen doctors, oncologists particularly, saying that they believe these shots are associated with, people will mock the term, but yes, the term turbo cancer is being used, and just a general rise in cancers among younger people. We see autoimmune problems that seem to be associated with these shots. From what I understand, there's over 1,000 peer-reviewed papers indicating that these shots are harmful in one way or another. There's, of course, the vaccine-injured community who are the living account of the harm that's been done by these injections. I mean, people with horrific neurological disorders, people with unbelievable skin conditions. I mean, we could just go on and on and on about the harm that we've witnessed, the harm that appears to be associated with these mRNA injections. And my question to you, Dr. Lindley, which is something I already asked you on a Twitter space, is it possible for someone to have received an injection that is so harmful in other examples, yet be completely unharmed themselves? Because, of course, there are people who have taken their COVID injections and they say, well, I feel fine since I received my shot. I don't have any problems. And maybe that's true. Maybe there's going to be a problem down the line. I mean, it's all very confusing. It's all very difficult. I would say to some extent impossible to keep track of. So, Dr. Lindley, what do you say about that in terms of, can a person have received one of these shots and not basically been harmed by it? How, if so, is that possible? And if so, how?
Well, I would say that it is possible, because if you there's a website, How Bad Is My Batch, that kind of shows that there are some batches that were a lot more harmful than others. And I would say if someone received one or two shots and didn't go beyond that, there is definitely a possibility that maybe their batches were not as bad. And also, the vaccines initially were supposed to be held at certain temperatures and handled certain ways. So if it wasn't done the right way, the question is, were they truly active when administered? So I would say it's possible. One thing that we do know is more vaccines and boosters you have, is you're more likely to suffer the more significant consequences. So it's really the question of how many did someone have that needs to be answered, first and foremost. Also, your immune system definitely plays a role in it. So if someone has a very strong immune system and received maybe one or two vaccines, then them not having any side effect is definitely a possibility.
Interesting. Yeah, it's so hard for me to understand the nature of what some people have called a bioweapon. The injections have been called bioweapons on this program, even by some of our previous guests. And I'm having a hard time even conceptualizing these shots as a weapon. I mean, on the one hand, it seems to me that the public was treated very roughly throughout this. The authorities were very content with the idea of collateral damage throughout the entire ordeal, that, certain people are going to just unfortunately be sacrificed through all of this, which I find really troubling. But as far as if we were to refer to these shots as bioweapons, it's a very curious weapon, a weapon that can injure people apparently in so many different ways. Like Dr. Ryan Cole referred to these shots as the Swiss Army knife of injury and death, which, of course, is just, again, a reference to all these varied symptoms that people have experienced. But then, again, other people, they seem just fine, including even people I've heard who have received as many as 6 shots. I've heard firsthand accounts of people who have received 6 shots, and they say, I feel fine. They might have felt a little bit sick after receiving one shot or another for a short time, but they say they feel fine, which I find that amazing. When some people actually took one shot and had life-altering consequences. But I would love to move to my second question, which is, to what extent, and I know you have been involved with vaccine-injured forums because I've seen you in these spaces on Twitter, but firsthand and in general, to what extent have you come in contact with the vaccine-injured? And what can we do to get these people the help that they need? Because it seems to me they've pretty much been treated like roadkill. I mean, it's so disturbing how the vaccine-injured have been treated. It's troubling. I mean, I knew of people in general, just generally be good to care about other people. If they hear about an injustice, they want to do something about it if they can. But here we have this situation where people are trying to literally deny injury and to some extent even deny the very existence of these people, who many of which were just doing what they were told to do or doing what they thought was the right thing at the time. And now they have these terrible conditions that they're living with. Some people, of course, have died outright, but some people are suffering tremendously. And then they have the double problem of being stigmatized and even treated as though they don't exist. So to what extent have you been in contact with the vaccine injured, and what can we do moving forward to help them?
So, I'm connected with different groups and have vaccine injured patients myself, but I am working with React 19 with Dr. Joel Walskog and Brian Dressen, and we are opening a vaccine injured clinic, really chronic illness center here in Texas. So that's in the works, and it's going to happen this year. We've been kind of delayed with all of the applications and the process itself. I think the most disturbing thing that has happened is the fact that medical community continues to gaslight this aspect of what's happened. To give you an example, if someone comes to see me for, let's say it's strep, and I give them amoxicillin because that's my first line choice, and then a couple of days later they call me and say, hey, I've developed a rash, I would consider that an allergy, and I would write it on my EMR that they have allergy to amoxicillin, because I don't want to know what happens next time I give it to them. They could actually have a more of a life-threatening situation next time. So I would put it as an allergy, and then change the antibiotic, and then next time if they have strep, I would give them something completely different so that there is no possible interactions. Now, when it comes to the COVID vaccine, we have had patients, not myself, but this is patients saying it. They had a reaction, maybe the first time, second time, and they said, well, I had this chest tightness, or I had this terrible rash, or I had some, slurring of speech, whatever they had. They had something. And instead of acknowledging the fact that they did have a reaction to a vaccine, especially someone who was healthy and had nothing else happening before, the health professionals will say, it's definitely not the vaccine, and you should get the booster to protect yourself. So then they would give them another shot, and needless to say, that second time the reaction will be a whole lot worse, because we have different cellular hypersensitivities. We have like class 1, 2, 3, and 4. So as you're giving more of something that's causing a reaction, obviously the next time the reaction is going to be worse. And that's kind of what we've seen. Some patients that maybe initially had some chest discomfort or maybe high blood pressure, but it went away, and they told them, oh, it's not the vaccine, and they get the booster, and then they end up with myocarditis or something like that. So I think that's probably the most disturbing aspect of what has happened. The people are being blamed as being anxious, stressed out, or just like I said, full-blown gaslighting. No, it's not the vaccine. It's everything else, but it's not that thing that you got and that's new. And that's really difficult to see from the medical perspective. Now, as the vaccine injuries are concerned, we are seeing different manifestations of it. And I think that there is probably a little bit of maybe genetic predisposition to what you might kind of have as a side effect, because people that tend to have cardiac issues or cardiac history are the ones that will tend to present with those type of side effects. And then you have others that might have POTS or neurological weakness or more autoimmune manifestations. So there are different manifestations of these adverse events, and each one of them has to be kind of taken separately and treated separately because they present a little bit different. So you have to try to find different solutions. In my opinion, there is no such a thing as detox. There are a lot of products out there that will claim you're going to detox yourself from it. Well, if the definition of detoxification, if we looked in the dictionary, which I haven't, but I would assume it is, detoxification means that there is an end result where you're completely clean and cleared of something. And in this case, what I've seen is with vaccine injury, we can help mitigate symptoms and we can help someone feel exponentially better, but they might have flare-ups here and there. So, you might achieve a state where someone feels really well and they're able to maintain it with healthy lifestyle, intermittent fasting, stress reduction, and things like that. But then something happens and they flare up, and then you have to put them through a little course of maybe medication or things like that. So I think, anyone who claims that there is a detox or cure is not being scientifically honest, because we haven't found a cure. We have found ways of making people feel better, and I hope that we continue doing that, and I hope that eventually there is a cure, but there isn't one now.
Right. I mean, there's so many confounding variables, it seems, just offhand.
It is, and that's how you have to approach it, like very individually. That's how medicine is supposed to be practiced. That's why I speak against the World Health Organization, because they want one size fits all. Medicine is supposed to be individualized. Medicine is supposed to be a very personal relationship between physician and patient, and you're supposed to really take the interest of your patients at heart.
I think that's such a key point, and I think that's almost, I guess, a moral value. Almost, it's an ethical principle. It's an intelligent thing to assert. And it's such a sad thing that we've been sent 1,000 miles in the wrong direction, that we went in the opposite of what you just said. And so many people thought it was so okay that we went in the wrong direction. It's a very intelligent thing to say that, no, we should not be pursuing a one-size-fits-all approach when we know everyone has a different personal history, different genetics, different environmental factors, so on and so on. So, how we started going so severely in the wrong direction is confusing to me. It's like, wow, weren't more people just aware of the fact that we should be trying to sort of customize things for each individual person's health as well as we can? Why is that a conspiratorial idea? I don't think so. But you mentioned the World Health Organization, and that's a perfect lead into the next segment of our conversation. We've had the privilege of having Dr. Meryl Nass on this program, who has been very outspoken in terms of the WHO Pandemic Treaty, the World Health Organization Pandemic Treaty, which contains a lot of concerning material in there. And then we've also recently had Dr. Rima Lebeau, who emphasized that the UN is actually the bigger concern, and that the World Health Organization is almost small potatoes compared to the implications of our contractual or whatever connection we have technically, officially, to the UN. And I know you've touched on this subject in previous interviews. You're outspoken about this. What should we be concerned with in terms of what you know? But also I would love for you to connect that in terms of, you have a very interesting experience as someone who grew up in Croatia and has lived in different countries. Please give the audience a bit of an overview of just first, I guess, your personal experience that led you to the worldview where you now are keeping an eye on these matters. So, what is it that you perceive in terms of what's going on? and what should the conscientious world citizen be aware of in terms of these various concerns?
So, when the COVID started, I looked at it through different sets of eyes. One was physician, and one was someone who grew up in communism. As a physician, I had a hard time reconciling when they told us to tell patients to stay home until they can't breathe and then tell them to go to the hospital. We're supposed to be the front line. We're supposed to, even if we don't know what it is, try to figure out how to help until we find a cure, right? Which we didn't do. So that really never made sense. And, being friends with many of the physicians on the front line, I just kind of took care of my patients, kept my head down, and, did the job I was supposed to do. At some point, I decided to speak out as well because I started recognizing the fear propaganda, the isolation, the bargaining, where like if you wear a mask, you can do this. If you're 6 feet apart, you can do that. And eventually, if you get the vaccine, you can travel, until they decided, well, people are not doing that. So, well, now you have to have the vaccine to actually go to work and bring back money to the family. So I recognize that kind of totalitarian approach to it. And because of my background and friendships, I really started looking at it from the global point of view. So even in our group, globalcovidsummit.org, that's the website with Dr. Urso, Dr. Cole, Malone, Dr. McCullough was part of it at some point, all these doctors. I was the one that always looked at the global aspect of it. And I actually got involved with WHO very early on, probably one of the earliest physicians to have been involved with this. Because I recognize that they're trying to do something that didn't make sense and should not be done. Before this, I actually always felt that even before COVID, Obama passed Obamacare, and I knew that was a way of introducing socialized medicine into the United States, and to me, that's a way of introducing communism, so I fought against that. So having this idea of global health through World Health Organization didn't make sense, and as they started talking about the treaty, which they now call the agreement, and the amendments to international health regulation, if you really dissect them, you realize that they are trying to kind of do this global governance over the health, become a global health authority. So Tedros always says, we are not attacking your sovereignty. These people are lying. It is not true. Well, it's interesting, and he always talks about the pandemic treaty. If you look at the pandemic treaty by itself, he's actually not wrong. There's nothing there saying that they will go after our national sovereignty. There's lots of problems in there, and they should not be signed because we would give up a lot of rights. But specifically, sovereignty is probably not enumerated. But then if you look at the amendments to international health regulation that he never speaks about, ever, he never mentions them. But if you look at that, there is something called Article 18. Article 18 says, in an event of an emergency somewhere in the middle of the world somewhere, Tedros can declare it a public health emergency of international concern. If he does that, he sets a whole, set of dominoes. One of them is he can mandate what type of examinations we do, diagnostic testing, treatment, vaccinations, quarantine, isolation. He can also close the borders and limit the trade into the area. Well, I just described to you two ways to go after sovereignty. One was individual sovereignty, because you just have WHO inserting themselves in the exam room between me and you, and I have to do what WHO wants me to do, or I'm going to lose my license, because the Article 44 says that if I speak against anything that WHO does, my government can come after me and censor me, which means they will take away my medical license. So I explained to you how they're attacking our personal sovereignty, but also they are attacking the national sovereignty because they just closed our border. If you have a supranational agency close a sovereign country's border, they just interfere with your sovereignty. So those are just few of the examples. There are so many articles in there that are, very wordy, but very heavy and very definitely interfering with the functions of the countries and our health. So many of us feel very strongly that not only we should not sign any of this or agree to it, but that we should completely exit the World Health Organization. Now, the problem is the pandemic treaty or agreement, if it's approved in May of this year at the World Health Assembly, has to go to our Senate to be ratified, technically. But they're trying to call it an agreement and not a treaty to bypass the Senate. So we'll see if they actually are able to do that. So that's number one problem. But number two problem is the amendments to international health regulations, these IHRs. IHRs, we have already passed them, we adopted them, we have been functioning under them. So when they change them, we don't actually get to approve it anymore. What we can do is physically reject them. But if we don't reject them, they do go into full force after a period of time. So we have a problem on two fronts. And because of the way the administration currently is placed, they will accept both of these agreements, and we will have a mess on our hands sometime this year.
Wow. Yeah, I mean, one thing that's so troubling about this as well is like you guys did such a poor job across the board, and now you get additional powers.
Exactly.
It's like in professional sports, it's like, sometimes a team will, play decently, but maybe not do that great, and then they fire the coach. And I think, well, come on, don't blame the coach. I mean, the team needs more experience. They need more talent on the team. But it's like the opposite of the capricious nature of how coaches are hired and fired in sports. It's like here you have, the health of the public being mismanaged. And it's like, oh yeah, let's grant you guys more powers to do more harm and to mismanage things more severely than before with just no critique. Just, we did our best. Everyone agrees we did our best. There's nothing we could do. We just needed more power was the problem. I just, and also we should also be very alert to any sort of, what's the word even, just subversive approach to the undermining of our rights. I mean, like, for example, with the whole vaccine, quote unquote vaccine push, they violated Nuremberg. Heck yeah, they did. Like some people, oh, it didn't violate Nuremberg. Well, yeah, it did. When you tell someone they can't return to work unless they've received an experimental medical intervention, well, yeah, that's a blatant violation of Nuremberg. Why were people so casual about overturning these really important rights that we had achieved? Now, I guess you mentioned socialized medicine just previously, and I view a lot of what has happened in terms of defects of capitalism as well. I mean, it seems to me that when you put profit over people, eventually that starts taking on a very malignant form. So, I think that I'm one who personally I'm looking to move beyond the pre-existing ideologies, the pre-existing political parties, the pre-existing things that have not worked to a large extent or have worked to a certain degree maybe, but ultimately we want more in terms of health care, in terms of respect for our human dignity, in terms of decent conditions within our communities, on our planet, etc. So if you could just play utopian philosopher for us for a moment, Dr. Philosopher in your case, what would a better healthcare system look like if you had your druthers, so to speak? If you had political power to say, we're going to fix these things, what would be some key things that we could practically implement that would benefit everyone involved, that the system would be more coherent unto itself and the public would have better health care as a result?
Well, I'm definitely not a fan of Medicare for all, Obamacare, or any type of government-run medicine. If you really truly look at it, it always fails. My friends in UK used to give me a hard time 2-3 years ago when I used to tell them that NHS is terrible and not the way that they should have medicine, but they felt their taxes are paying for it. So it's a great system until the system collapsed, and it's continuing to collapse. We're seeing same in Canada. I'm also not one of those people that believes that healthcare is a right. Access to healthcare is important, but healthcare is not a human right. One of the ways to explain that is if healthcare was a human right, that means that I, as a physician, should give it to you just because it's your right. But whether it harms me or not, it doesn't matter to you because it's your right. Now, access to healthcare is a different matter. And how do you do that? So, people always talk about capitalism being bad, and sure, there are a form of, and I'm not a financial person or economist, so take things that I tell you with a grain of salt. But I think when you talk about how do you fix healthcare, I'm actually a believer in free market healthcare. So in a sense, there's always definitely a percentage of population that will need help. And that's why we have Medicare and Medicaid, and those programs need to be revitalized. They need to be, even in that area, I think some good competition wouldn't hurt them. But I think it's important to have a safety net for people who truly deserve, who need help, right? So you can never get away from it. And I'm totally fine with that. I feel that, the system should be able to help them. What you have to realize, the problem is not medicine. The problem is the system behind the healthcare. Medicine is cheap. Healthcare is bureaucracy. So the things that cost the most in healthcare is actually the insurance companies, the 10,000 support staff that you have to have so that you have to call the insurance for approval or for medication or for procedure. I practice actually outside of the system. I practice privately. My practice is called direct primary care. I have a contract directly with the patient. It's a monthly membership fee. My prices are online, so I don't mind sharing them. For children under 18, it's $35 a month. 18 to 39, I think it's 60. 40 to 64 is 85, and 65 and up, it's 110 a month. That includes 24/7 access to me, as many visits as needed, in-house, things that need to be done. And the rest, if you have insurance, we can use your insurance for x-rays, for labs, for medication. If you don't have insurance, I have contracts directly with radiology department and lab places where you can get your labs for $2-3, depending which lab it is. Some of them can be more expensive with their specialty labs. X-rays anywhere from 40 to 60, MRI 400. I think ultrasound is like 75, CAT scan 175, something like that. But again, you can shop around and find your own prices as well. You don't have to go to a place necessarily that I recommend, because the key is to empower the patient to know exactly how much something costs and then shop around and find the best prices.
Right.
So the way you fix healthcare is by being in a driver's seat. I'm also a firm believer that everyone has to pay a little, whatever that is, because, if you really look at your life, anything you get for free, you don't value it as much as when you actually have to pay for it, even if it's a little, because you feel you're giving your hard-earned money and you want something in return for it. So you invest yourself more.
Yeah, it's kind of a universal law almost.
Yeah, and the reason I believe in free market, and I know free market is a dirty word if you're a Democrat, but the reason I believe in free market healthcare systems is if you and I are competing for the same person, then both of us are going to try to be as best as we can and as cheap as we can be, because we're competing for the same person. And that's how you bring the prices down.
Well, that's very insightful, and I appreciate that answer very much. I don't know if free market is a dirty word necessarily if you're a Democrat, though, because, when Obama gave his inaugural speech, I remember that was the thing that stood out to me actually more than anything about his inaugural speech from his first administration is he, gave his flowery rhetoric stuff at the beginning and, we have hope and we have change and a better America and everybody deserves a chance and everything. And then he kind of awkwardly segued into, but it is the free market in which we still have the greatest chance for prosperity. And that to me was where he sort of shifted the speech in terms of speaking to the people who had invested in him and his handlers, which is primarily from Wall Street. And I don't know. I find it interesting when people say that like the Democrats resemble like a communist sort of regime or something, or that they don't really have a lot of very socialistic rhetoric, really. They're getting into some pretty abstract stuff like the disproportionate discussion of transgenderism and sort of co-opting Black Lives Matter sort of randomly, arbitrarily at a certain interval around the George Floyd incident. But, they don't really, they're not guaranteeing us much in the way of health care or housing or,
Well, people think like having health care, they promise you're going to get health care or whatever. It's this panacea or whatever, but it's was going to use a bad word, but it's not. Because even if you, so for example, my husband gets his insurance through his work, and I forget how much he pays just for him. But to put us on his system would have cost several thousands of dollars. So what we end up doing is signing up for a Medishare, and you can combine Medishare with direct primary care practice like my own, and you can actually save a lot of money. So people need to start looking like, what are you getting with your insurance? If you're having to pay a premium, a couple $100 a month or whatever it is, but then you have like $20,000 deductible. Well, are you really saving any money? Maybe you should put that $20,000 in a savings account or whatever and get yourself direct primary care doctor that costs at the most, like my highest price was $110 a month. So 110 times 12, what is that, $13,000 a year? And then if you get, what's it called? I always confuse the words, but there is like type of insurance you can get, catastrophic insurance, like if you end up in a hospital, which is a very small
single
premium.
payer.
Yeah, so you can you need to start thinking, where is your money going? How do you want to spend your money?
Right.
And then, for example, if you have, if you're employed, a lot of your employers will have health savings account as a benefit where they match your money. So you have like pre-tax money. You can use your health savings account for different things, even for paying for the doctor outside of the system. But we need to start being smart about how money is being spent and where is it being spent, because, having healthcare, it's not what you think it is. You still have these huge high deductibles, and you end up spending a lot of money for a lot of things that you don't need at the end.
Yeah, it seems very wasteful, especially here in America. Well, I want to ask you one last question before we hopefully take some calls here, because we're actually on a good schedule here. Normally we get all jammed up and we try to sneak in a call in the last 10 minutes, but we're doing a little bit better in terms of time, thanks to your concision. Thank you for that, Dr. Lindley. But a question that I've had just floating around in my brain for, I don't know, the past week or so, and I'm really so unclear about my own answer to this question, my own opinion even about this question that I have. And the question is basically, with all that we've witnessed in the past 4 years, the emergence of the biosecurity state is one way I'll refer to it. The COVID psyop is a way you might refer to it. The coercive vaccination campaign. All of these things that we've witnessed, we've experienced. To what degree do you think we witnessed human folly, and to what degree do you believe a master plan has been executed? So, but from the range of folly to precision in what has occurred, to what extent has everything gone according to plan, or do you think it's just another example of just human mistake making and folly? Like, actually, there was an interesting term. A lot of people are familiar with Occam's razor, but then there's the lesser known Hanlon's razor, which apparently is do not attribute to corruption that which can be explained with incompetence. So what's your opinion on that? How much of this is intentional harm to people, and how much of this is a lot of mistake making?
So, people will ask me, like, who is doing this, who is behind this, and things like that. What happened? You talked about bioweapon early on. I choose to still believe in humanity, in a sense that, like, I think that they made a lot of mistakes. They tried to put something on the market that wasn't ready. They probably did it knowing, how much money is going to be involved. A lot of corners were cut. A lot of harm was done. And instead of acknowledging mistakes and moving forward and trying to correct them, they double down and they keep on continuing to do it. Some people will say, well, they're trying to kill half of the population because of the elite agenda and stuff like that. We can all hypothesize and think about why and how it's happening. But I think at the end of the day, when you look at it, it's greed, it's human error, and the fact that they cannot admit they were wrong. I try not to think about other reasons for it, because if that's the world we live in, it's extremely dark, and it's probably not the world I would want my kids to inherit.
Yeah, I hear you.
So,
as a father of two young kids,
yeah.
I definitely hear that.
So I think, like, we can all speculate why it happened. I think one thing that I find the most disturbing is the fact that we've seen how much damage has happened, and instead of saying this is bad, it's not working, it's causing damage, and lives have been lost, we have CDC talking about the 9 booster that they just did, and next this fall we're going to have a 10 booster. That's kind of where I feel whatever happens, they're going to get what they deserve at the end. Because I think, I'm not sure if you remember, like, a teacher or a mentor or someone who did something wrong, and then they realized that maybe you pointed it out to them, and they realized they did something wrong, and they said, I'm really sorry, you're right, this is really wrong, and I should have done it this way. And I would venture to say when they admitted their mistakes, you actually respected them more.
Yeah, absolutely.
Instead, we have this whole community of scientists and these organizations who, instead of saying, we just really went the wrong way, instead of kind of saying, trying to correct those mistakes, they keep on doubling down on them. And that's what's unforgivable.
Yeah, I totally agree. That's a great point. If you would, could you tell me what city you're in Texas? I have some family in Austin. I have family in Houston, and I'm a huge San Antonio Spurs fan. I've actually flown all the way to San Antonio, Texas, just to see basketball games.
Well, we are Texas Rangers fans, so you should know what that means.
Arlington?
I'm in Fort Worth area.
Okay, well, that's great. Well, we actually have a great caller on the line. We have my friend Phil from California on the Bassline. Are you there, Phil? Can you hear me?
Yes, I am, Jeremiah. Thank you for taking my call.
Oh, my pleasure. It's good to hear from you, brother. What are your thoughts today? Please speak to Dr. Lindley, please.
Well, my thoughts are, one of my main interests is economics, and we did touch upon this in this discussion today because Dr. Lindley mentioned her experience with socialism and communism and the authoritarian aspects of growing up in a country that apparently she grew up in that had authoritarianism and was ostensibly a socialist or communist country. And so I would like to bring my training, my degree in economics, to bear into the discussion because I think it's important that we get to the root of the problem to find meaningful solutions. I do empathize with people that grew up in the Soviet Union or Soviet nations or communist China where there was authoritarianism. But I remind people that socialism does not necessitate authoritarianism. Nazi Germany was capitalist and it was totalitarian, but often people do not think capitalism equals totalitarianism. So it's important to remember that we can have authoritarianism in either a socialist economic structure or a capitalist economic structure. In order for us to make sense of the war against economic medical freedom and the attempts to establish a global government, I think it's very important that we think more deeply about economics and political economy and how, for example, Dr. Lindley mentioned greed as being a cause for all of this. And I would elaborate upon that and say that it's profit motive that is the cause of all of this, because our economic structure in the United States, in the West, and most of the world is capitalistic. And that is what has led us to, as you say, Jeremiah, put profits over people. And the profit motive of capitalism is what's going to lead us here. And if we do not recognize that, then we're going to look at superficial causes and then end up back in the same place. So people often conflate communism with the global power elite, but the World Health Organization is a capitalist institution, and the United Nations is a capitalist institution. Wall Street created the CIA, for example. We can look at many books. David Talbot, I believe, is one author. Professor Peter Phillips wrote the book, The Global Power Elite. I recommend everybody read The History of Economic Thought by E.K. Hunt and Mark Lautenheiser. That was taught to me by Professor John Henry in my training at the University of Missouri, Kansas City. The doctor believes in free market, but there are no free markets. Dr. Michael Hudson, economist, often reminds us that free markets are a myth. All economies are planned economies. It just depends whether the economy is going to be planned by the people for the people, or whether it's going to be planned by Wall Street for the elite and the power elite. So we have class conflict, and this class conflict has been going on for a very long time, for thousands of years, if not forever. People could not read, people were not allowed to read, and people did not understand economics. all of the economics were mystified. So people have not understood capitalism. And the way that the free markets are presented to us is as a way of liberty, but labor is at a disadvantage because the power structure favors the owners of businesses and corporations, and workers have no power in relation to the owners. So we have unions, we have the 7-day work week, we have all of these ideas that have come up, Social Security, healthcare. These things are ideas of socialists. And I just want to impress upon everyone that socialism is, the spirit of socialism is to empower workers, recognizing the imbalance between workers relative to the owners of companies. I mean, I know I've spoken for a long time, but I would remind people that Dr. Richard Wolff reminds us that socialism means democracy at work, right? We want to have democracy in our society, but when we get to our workplace, it's an authoritarian situation where the workers have no power. They have no say in how the profits are distributed by the company. But if we have unions, if we have an equal power distribution, the workers are going to be better off, and that will be reflected across our society. But we don't have that.
Yeah, Phil, I hate to interrupt you, Phil, but we do have some other callers, and
I just want to say that I 100% disagree with the whole idea that socialism is this utopia solution to our problems. Socialism is a lie by which they try to introduce communism into a country. There is no truly socialistic society that has existed without the communistic elements to it. So I respect your opinion, but I definitely don't agree that socialism is this ideological, ideal form of economy that we should all strive to empower people.
Yeah, I mean, I think, there's sort of the perspective, and I'm not saying I agree with the perspective, but there's this attitude that, we've never really achieved so-called socialism or communism per se, because there was just never the dictatorship of the proletariat, a vanguard dictating things. It's not the dictatorship of the proletariat. But likewise, people will say, this isn't capitalism. We don't actually have a free market. It's a mercantile system to some extent. Like, even as a musician, if I go and say, I just want to set up right here in a public park, I could be subject to fines. I could have my instrument confiscated. I'm not allowed to, freely use my talent in the marketplace. I'm subject to restrictions, et cetera. But I think it's a very interesting conversation. And I appreciate the call, Phil, and I very much respect your response, Dr. Lindley. We have Noel from Brooklyn. Are you on the line with us, Noel?
Yes, I am. Good afternoon to both of you. A quick question, since I know you're running out of time.
Yes,
Dr.
sir.
Lindley, I would like to know if COVID is, some people say that you could be asymptomatic, of course, meaning without symptoms. How can that possibly be if it's a respiratory disease?
Right, and severe acute respiratory syndrome.
Right. So in other words, there's and I'm not trying to insult you, Dr. Lindley, I'm just explaining, some people may not know. The thing that they put on your finger is called a pulse oximeter. And generally around 98% saturation of oxygen is there. So how can you be asymptomatic and still have a 98% pulse oximeter reading?
Great question.
Well, it's not necessarily being asymptomatic. The symptoms were just presented in a different constellation of symptoms that we were usually associated with hypoxemia. So usually if you have someone who is hypoxemic, you expect them to be breathing at higher rate, have shallow breaths, and say that they're short of breath. In the acute phases of COVID, some of the patients presented, breathing normally, but their oxygen saturation was lower than normal, and some of them had cough, fevers, and other symptoms.
Because Dr. Lindley, I had a friend that they said had COVID, and he had a heart attack. I repeat, he had a heart attack. He had a 100% pulse ox reading. Impossible.
Again, so how did he present to the hospital? Well, but you know the answer to this anyway, because patients would present with whatever. Like there was, I can tell you early on, a friend called me from Austin because he was looking into the data that they were trying to say that the numbers were really high, and that's someone who died in a motor vehicle accident, and his cause of death was COVID. Person died in a motor vehicle accident. He did not have COVID. So, your friend probably presented with heart attack and the symptoms and signs of it, and they did this testing because at the time they were doing it on everyone, and then his primary diagnosis ended up being COVID when it should have been cardiac. So.
Yes, thank you.
Yeah, that was one of the ways that they cooked the books, so to speak.
Yeah, exactly. So they would test everyone and anything, and even if you came for broken leg because you were jumping or fell off of somewhere, and that's really the only primary thing you came for, they would put COVID as number one if incidentally you tested for COVID. Right. So there was agenda behind it for sure.
Yeah, I mean that was one of the big features of what happened. Well, we're just right up against the wall here. We're out of time. I appreciate you appearing on the Bassline, Dr. Kat Lindley. Thank you so much for your courage, for your wisdom, and for being such a consistent voice throughout this struggle.
Well, thank you for having me. I really appreciate us having this conversation today.
Absolutely. Well, keep up the great work, and everyone, please go check out my Substack. Please get a Twitter account if you don't have one already, and follow all of the wonderful guests that we've had on this show. And you've created a great pipeline of information for yourself, and you can weigh in and join Twitter Spaces and other areas and places where people are communicating, exchanging ideas. But everyone have a great weekend. That was our episode number 33. It will be archived Monday morning. Everyone have a wonderful weekend. Happy holidays, and peace and love to everyone. Thank you.
From a book or from the news, it's not like that 'cause it's a thing. It is something that you do.